Okay, thanks again for joining in. People are still logging in, so I won't be starting for just a few more minutes. I appreciate those of you who have let me know your name and where you're from. Currently, the prize goes to the farthest distance in being South Africa, which is pretty cool. But also listeners from United Kingdom and Kansas. Hi, Jerry. Jerry's a longtime user. I know him well, and his wife, of course, and throughout Canada and the United States. So I appreciate you listening in today. I'll have lots of time for questions at the end. Just so you know, the webinar will be recorded. And if you ever want to rewatch it or what have you, you'll be sent an email with a recording of it to watch again. And in future, if you want to watch a webinar and you can't watch it live, then register and we'll still send you out that link. And alternatively, you can also go to our website and find our webinars there as well. So a little bit of formatting for the webinar. It's usually 30 minutes in length. I try not to make it too long. In that time, I try to go over the nature of the condition that I'm talking about, or the main topic, a little bit about our equipment, and specifically how you would be using our equipment and what it would be doing for the condition that that we're talking about. My name is Dr. David Kanashko. By profession, I'm a chiropractor. Before that, I was in molecular biology and molecular genetics, where I did graduate work and undergraduate work at University of Toronto. And I've been involved with photobiomodulation. Many of you probably know it as laser therapy or red light therapy. There's lots of different names for it. But I've been in the capacity as a medical director here at BIOFLEX. We're out of Toronto, Ontario, Canada. So we're a Canadian-based company. So again, if you're just tuning in, let me know where you are, if you have our equipment. It seems that most people actually do have our equipment, which is great. And if you are enjoying the equipment or it's helping you, we really always love to hear referrals or telling your friends or family about us as well. A lot of what we do is by word of mouth. We're a small company, so we don't have a huge marketing or advertising budget. But to the most of what we actually sell and support come from referrals, which speaks volumes as well. Okay, so again, a few more people kind of settling in here, and they'll probably join us as we go along. I'd like you to use the chat box to let me know your name, where you're from, if you're using BIOFLEX or just interested in it, and the Q&A box if you have specific questions for me as we go along in the webinar, and I'll address those questions at the end of the webinar. So once again, I just want to make sure everyone can see and hear me. There's no issues with that. So preferably, you've all let me know that, but if there's a problem, then you can just let me know as well too. So today's agenda is really a pain in the you-know-what, because I'll be talking about sacroiliac joint pain. I'll introduce our personal systems. I tend to do two types of webinars. One is for personal consumer devices that people can just purchase and use at home for different conditions. And I also do a series of webinars for healthcare professionals, more targeted, obviously for specific conditions, a bit more technical, or you might say scientific. Although you might be surprised today, I'm going to use a lot of interesting terms, but also to gear towards our professional equipment as well. But you're free to watch any and all the webinars, because hopefully you get a little bit of information out of all of them. So I'll introduce our equipment, talk a little bit about sacroiliac joint anatomy and what causes pain. It's quite a complex joint. So I'll try to do my best to explain what the heck is going on with the sacroiliac joint. And I'll talk about, standard treatment of care and what you already may be doing or have been offered for this type of problem. And then specifically why you would use BIOFLEX therapy for treating pain in the sacroiliac joint or the other symptoms that go along with it. And then finally, how you would engage and use the equipment to actually do that. And again, if you have any questions, let me know in the Q&A box as we go along, and I'll address those questions at the very end. Whoops, there we go. Okay, so if you're not familiar with equipment, although I think most people are, because it seems that most people use our equipment that are tuning in, we have two types of consumer level devices, a P120 and P180. They really differ with respect to the number of active diodes that emit red and near infrared light. And the P180 does have a slightly greater power output, but essentially the end result is the same. Of course, with a larger, more powerful unit in the P180, it covers more territory, you might say, for larger patients or larger areas that you might be treating as well. You know, end of the day, it's controlled by a controller that has preset protocols. The light pad or the light array, as I mentioned, has two different colors of diodes, red around 660 nanometers and near infrared weighing in at around 830, 840 nanometers in wavelength. I won't get into the reasons why we use those wavelengths. I've done that in the past, but we know from decades of research that have been published that those two specific wavelengths are the best wavelengths that actually do the stimulation inside the cell and the tissues that are injured or effective. One of the differentiating features of our equipment is, number one, it touches the skin. If you're using equipment that doesn't touch the skin or recommends you hold it a distance away from your skin, Juve comes to mind, and a whole bunch of other ones. Be aware that light reflects off hard surfaces like your skin. So you will reflect 80, 90% of light coming off the skin. You can see that we have little magnifiers or diodes that come out and stick out. They're meant there to depress and push into the skin to ensure more light enters the skin and goes deep to the skin to treat the problem, which is what you want. Nearly every clinical research trial published in PubMed and around the world uses contact technique. So I say that because there's a lot of misinformation or a not understanding about how to use light therapy. And when you see devices like Juve and the rest of them that advocate it being held away from the skin and kind of bathing in it, while that might have some benefit, it won't be nearly as therapeutic and nor as directed as a device that touches the skin. So that you need to understand that before you choose a device to use. So our devices look something like this. You can see there's different protocols or anatomical regions. It's quite easy to use. I have a series of webinars on how to use it. Of course, there's a manual as well too. Today, we're interested in using the lower back protocol, obviously, because we're treating sacroiliac joint pain. The controller has a power button, a stop button, a start, pause, and select stage intensity buttons as well. So again, pretty straightforward and easy to use. I like to try and start off these webinars with a good quote or fact. And as I was doing the research for this webinar, the most up-to-date information is that the sacroiliac joint has been implicated in up to 25% of patients that are complaining or suffering from lower back or leg pain or pain in the butt area. So that's a lot. When you think about it, I know when I was in active clinical practice, I've been practicing for over 30 years, not as much now, mainly because I'm the medical director, and so I'm pretty busy doing that. But with lower back, I would say that many patients coming into me, one of the sources of the pain and their symptoms were coming from the sacroiliac joint, and especially in women who have given birth. And I'll talk a bit about that as well. This is from the Journal of American Academy of Orthopedic Surgeons in 2019, by the way. So let's talk a little bit about the sacroiliac joint. I think we're kind of appreciate where it is. It's the lower portion of the spine. It's a connection of the ilium or the hip bone to the sacrum or the tailbone. And you can see the skeletal formation there and the big blue arrow pointing the general area where the sacroiliac joint, there's two of them obviously, reside. This joint is the largest spinal joint or axial skeleton joint in the body. So it connects, as I mentioned, the pelvis, and it transfers the load between your spine, the lower back, down your extremities. So when you're running, jumping, walking, moving, doing all the crazy things that you do, which, by the way, I was chopping wood on the weekend, and let me tell you, maybe I shouldn't be doing that anymore because, wow, I put out my back, I strained a muscle, it was an SI joint, and yes, I used laser therapy, and that happened on Sunday. I'd say I'm 80% better, but lower back issues are debilitating. If you've experienced them, you know that. So this joint functions as a shock absorber, and it basically converts torque from the lower extremities and into the rest of the body. So it's a critical joint in functioning of everything that we do, basically. Now, the sacrum or tailbone can move on the hip bone or the ilium very minutely, very slightly. They measured it, I mean, depending what you read and blah, 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 lots of research, maybe a few degrees, up to 6 degrees of freedom of movement. Not a lot. Sometimes a joint can be hypermobile, excessive movement. Sometimes it can be hypomobile, decreased movement. And both of those cause problems and potentially cause problems in the SI joint. So as a chiropractor, hypomobility would respond really well to manual adjustments of the SI joint. Hypermobility is where you need to be a little bit more careful because you want to stabilize the joint. So as I mentioned earlier, in women, they tend to have a lot of SI joint pain, in part because the ligaments are weaker, just because of anatomical variance, but also secondary to hormonal release. I'll talk about that shortly. During childbirth, this can cause ligament laxity and damage. Of course, during the childbirth itself, it can cause problems as well. So the lack of mobility in sacroiliac joint favors strength and stability to weight-bearing capability. So the purpose of it being very stable is to prevent excessive movement in that area. So this is important because we try to remain erect when we're walking and standing and doing all the different things. We don't want to be all kind of pivoting like a bobblehead, right? So now during childbirth, what happens is there's a hormone that's released called relaxin, which is an aptly named hormone, and it causes the ligaments to loosen up in preparation for childbirth. The problem is that when the joint loosens up, it can kind of cause problems long term. If you look at the sacroiliac joint, and here's the anatomy of it. So what I've done here is they've removed one of the hip bones, so you can see the attachment or the articular surface between the sacrum and the ilium. There's actually two types. It's a really weird joint. There's two types of joints there. The yellow portion is a regular synovial joint. Hyaline cartilage is on there, glistening cartilage. But on the other portion is fibrocartilage, which is a lot less movement involved as well, has more ligaments around it, and it gives it more inherent stability. So there's a bit of movement to it because of that hyaline cartilage aspect of the joint, but because there's so much fibrocartilage and ligaments surrounding it, then there's actually very little movement. So you can see here an actual cadaver sample. The red kind of portion is the fibrocartilage. It's very little movement. It's kind of glued together almost, whereas the white portion, the glistening white portion is hyaline cartilage, similar to what you'd find on a knee joint or a hip joint. Lots of different ligaments. Purpose of me today is not to teach you anatomy per se, but there's lots of strong ligaments that support this joint, both on the rear side or back side, posterior view, you might say, or the anterior or the front side of the hip. And you can see all these different ligaments in front of you. Again, I'm not going to go into naming them all and so forth. Now, most SI joints are facilitated by tension on the ligaments by the surrounding muscles. There's actually over 40 muscles that pass or control to some degree movement of the sacroiliac joint. I'm going to name every one of them coming up. No, I'm actually just kidding. I won't, but I will name a few of the most important ones so that you pay attention to those muscles, because ultimately you will probably have to strengthen and or stretch those muscles as well in your rehabilitation of getting sacroiliac joint pain better. So the muscles that are key for this condition are your back muscles, sometimes called the erector spinae. There's a whole series of different ones, including the QL or quadratus lumborum and multifidi. These are critical muscles that support the hip. And then there's the hip muscles, especially one called the iliopsoas or the psoas major. That's the one that flexes your thigh upwards. It causes a lot of back problems in general, the psoas does. The core muscles, like your abdominal muscles, rectus abdominis, are critical for stabilizing the sacroiliac joint. Your buttock muscles are the gluteal muscles, especially the gluteus maximus, as well as the piriformis, a small little triangular muscle deep in the buttock. And your thigh, your thigh muscles, especially the hamstrings. So you need to understand that when I'm talking about using our device, you had better be aware that you better be doing other types of rehabilitation exercises, strengthening, and other techniques to help your condition. And I'll talk about these things again as we go along. Just a quick overview of the muscles. You can see the gluteus maximus, the piriformis, the hamstrings, the erector spinae, and they all contract and pull on the ligaments and support that ligament, the sacroiliac joint. It's not like they're causing movement per se, a little bit. They're more in a supportive role when we're walking, bending, standing, jumping, and doing all the crazy things that we do. The movements of the sacroiliac joint are complex. They use a term nutation. So nutation occurs essentially when you flex your hip, and this causes the the sacrum to tilt downwards and anteriorly by that upper green arrow, and then the coccyx, or your tailbone, and the inferior portion of the sacrum to tilt posteriorly backwards and in the opposite direction. So you can see the green arrows. And that movement is occurring when you flex your trunk or you extend your hip. Same thing, right? Not the same thing, but that movement is what is occurring. Now, counter nutation is occurring more with extension of the thigh. This is the exact opposite movement that I've just described earlier. You can see the green arrows indicating the opposite movement. Again, these are little tiny movements, not big movements, okay? But the movements nonetheless are critical for functioning of your pelvis and the mechanics of your back. So if your sacroiliac joints aren't moving very well, even that small little degree of movement can cause problems. Now, be aware that as we age and you get to your 50s, 60s, 70s, and 80s, the sacroiliac joint often fuses. So a lot less mobility. Usually that can create some problems, but we tend to compensate, do other things, or maybe not as active perhaps in our 80s or 90s, but we really should be. And so you may not notice it as much. There's also something called sexual dimorphism, which is, of course, differences in the skeletal bony aspects of a male and female pelvis for obvious reasons for childbirth. And you can see here that males tend to have relatively longer and narrower pelvis, whereas females tend to have more conical shaped pelvis, allowing for childbirth. Now, these sex-related differences can actually lead to the development of sacroiliac joint pain. You tend to see a higher rate of malalignment or misalignment in the sacroiliac joint, especially in younger women, as well as things start to shift and the way that the pelvis develops as they enter adolescence. It's not uncommon. I remember, again, when I was seeing a lot of patients, that a lot of young women would come in, their moms would usually bring them in, or their parents, and sacroiliac joint dysfunction was a big problem as well. Lots of different causes of sacroiliac joint pain. So everything from a ligament sprain, I mentioned earlier, hypo or hypermobility. There can be compression forces, shearing forces, micro, macro fractures in car accidents. Oftentimes, if you're in a car accident, you push your feet out to support you, or especially even one foot on the brake, that can actually lead to trauma to the SI joint, and that won't be experienced until a little bit later. If you've been in a car accident and you said, oh, I have a bit of neck pain, everything's fine, then a month later, 2 months later, you go, oh, my back is killing me, and the insurance closed the claim because you said, oh, I'm fine now. That lower back pain is because of an injury to it, but didn't actually, you didn't become aware of it until things start to shift around and you start to notice it. So one word of advice, I used to do a lot of medical legal reports for lawyers and people in car accidents, is don't close a claim until you know you're 100% okay. And sometimes it takes some time, months sometimes, before you start to have those symptoms manifest. So as far as injuries go, oftentimes it's due to axial loading or abrupt rotation. Axial loading is like jumping or falling, on your feet, that kind of thing, or abrupt rotation, twisting your spine or your pelvis quickly is very common cause of sacroiliac joint pain and dysfunction. Essentially, when a female becomes pregnant, you can imagine there's a shifting of the mechanics of the lower back and the pelvis. All of this shifting, you get an exaggerated lordosis of the lower back. Back pain is very common in pregnant women. If you've ever been around a pregnant woman, or you yourself have been pregnant, you know this. So it's important to do things that can be helpful in these cases as well. And I mentioned earlier, one of the key factors here is a hormone-induced relaxin that causes ligament laxity. And this predisposes pregnant females to sprains and issues in the SI joint ligaments. Sometimes it can even cause subluxations or partial dislocations as well, especially during childbirth. Oh, but kids are wonderful, right? We do that so that we have wonderful kids, right? So just kidding. No kidding. I do have a son, so yes, I'm well aware of that. But okay, so there are some factors that predispose someone to sacroiliac joint pain, including leg length discrepancy. Now, as a chiropractor, I have to tell you this, that I've seen many people with low back problems and their leg lengths are different. This can be anatomical, meaning that's the way the bones grew, or it has to do with contracture or tightening of one area of the hip and pelvis compared to the other one, and the leg actually appears to be different. This needs to be corrected. So if this is the case for you, and have someone check that out, then it needs to be determined, is it anatomical, meaning that's the way you grew? If that's the case, then you need to have heel lifts. And if you do that, it will really help. And they need to be graduated. You need to know someone that knows what they're doing to do that. If it's not anatomical, then it can usually be corrected through manual therapy, whether it's a chiro or a physio or what have you. Of course, my preference might be a chiropractor, but of course, physios and massage therapists and the rest, they all deal with these issues as well. There might be gait abnormalities. Maybe your knee is bothering you and you're walking funny, or whatever the case may be. Maybe you have Morton's neuroma, sprained ankle, or whatever the case may be. This may also cause increased mechanical stress on the sacroiliac joint. SI joint pain is very common in folks that do lots of prolonged, vigorous exercise, running marathons, 10K races, like all those kinds of things. They put a lot of stress on the sacroiliac joint. Skeletal malformations like scoliosis can also cause increased mechanical stress to the sacroiliac joint. Sometimes people are born with spinal fusion of their fifth lumbar vertebrae to the sacrum, or have even had surgery as well for fusion. That can also increase the chances of sacroiliac joint pain. And there's common conditions, rheumatic diseases like rheumatoid arthritis, ankylosing spondylitis that can cause direct inflammation inside the sacroiliac joint, and that's called sacroiliitis. Now, there's two ways of looking at this. There's something called sacroiliac joint syndrome and sacroiliitis. Sacroiliitis is inflammation of the joint, not necessarily due to trauma or mechanical stress. Sacroiliac joint syndrome is due to abnormal mechanical stress that will lead to inflammation. So kind of the same, but not the same. So let me just describe that. So let's talk a little bit about sacroiliac joint syndrome first. Very prevalent in athletes, by the way, or if you're active. It's also sometimes really hard to diagnose as well, because back pain is back pain, and you say, oh, I have back pain. And but you know what? This is a common cause of quote unquote back pain. So you need to make sure you know what you're dealing with before you start to do any kind of treatment. Some of the most common symptoms for sacroiliac joint syndrome is pain over that SI joint buttock region, gluteal region. It can be sharp, it can be stabbing, it can be shooting down the buttock, even down the posterior thigh, but not usually past the knee. That's really important, because if you have pain going past your knee, down into your leg, into your foot, that's usually, well, almost always from a nerve from the lower back or the sciatica, that kind of thing. So that's quote unquote sciatica. This can sometimes mimic sciatica, sometimes called pseudosciatica or what have you, but it's not sciatica. Other symptoms include, so again, it can mimic radicular nerve pain. I mentioned that. You oftentimes will have difficulty sitting in one place for too long due to pain. You shift side to side. If you're doing that in the car or while you're watching a movie or at home, that's sometimes a good sign that you might have SI joint pain. But of course, you may not. It may be the lower back as well, too, but it is a sign. There may be local tenderness if you palpate or push down on something called the PSIS. So right now, if you feel behind your back, around that area, you'll feel a little lump or a bump. It's quite pronounced, and it kind of moves a bit when you move your hip. That's the posterior aspect of the sacroiliac joint, the posterior superior iliac spine. The pain occurs when the joint is mechanically stressed. So typically forward bending, or if a healthcare professional kind of pushes your joints while you're lying down, you'll get that pain reproduced as well. Then there's sacroiliitis, okay? Not to be confused with sacroiliac joint syndrome. Well, it is to be confused because it's similar, but the causes are a little bit different. Here we're talking about a inflammation inside the joint, not due to mechanical problems. So osteoarthritis. Now that's secondary to mechanical problems or just aging. Inflammatory rheumatic diseases, ankylosing spondylitis. There's something called Reiter's syndrome. I didn't put that down, but that's can occur. Rheumatoid arthritis, psoriatic arthritis, even chronic inflammatory bowel disease causing systemic inflammation can cause this problem. So I've talked before a little bit about gut inflammation, and actually you can use photobiomodulation or BIOFLEX over your gut to help reduce GI tract inflammation. Although I highly recommend that you take a good healthy dose of psyllium husk and or other fiber every day, like I'm talking a lot, to reduce gut inflammation. That will help overall with your GI tract inflammation. Of course, pregnancy, that's kind of, mechanical, but pregnancy can lead to inflammation of the joint. So it's kind of like a bit of both of the same. Trauma, same deal. I mean, trauma will cause mechanical stress for sure, but then you end result with inflammation inside the sacroiliac joint. Then there's serious conditions like infection called pyogenic sacroiliitis. So, even malignancy, cancers can cause, it can be in that area. So you need to know what you're dealing with. Don't try and self-diagnose. Don't go to Google Doctor, Dr. Google and figure it out. Please go to a healthcare professional. Symptoms of sacroiliitis, pretty similar to SI joint syndrome, but especially prolonged standing, because that will stress the SI joint where it's inflamed. So, when you're standing around a lot at a trade show like I do sometimes or whatever, and it's like, oh, my back is killing me. And it's like right in that area, that's a SI joint problem. Bearing more weight on one leg than the other, stair climbing, running, taking large strides, these can all increase stress to the SI joint and therefore inflammation of the SI joint and sacroiliitis. Okay, so how is this condition treated? Well, traditionally, medications, NSAIDs, muscle relaxants, or if you have rheumatic diseases, then specific medications to treat that. Injections, steroids, anesthetics, something fun called radiofrequency ablation. That's not fun, by the way. And that's more of an invasive procedure. Surgical joint fusion. These are all potentials that medical, folks might consider for an SI joint problem. Of course, I kind of prefer that we look at the SI joint as a sum of everything else that's going on in the body, and therefore treat all those different things. You will have more success than just trying to, pop a pill or get out a scalpel. So traditional rehab is going to focus on strengthening, stretching the affected muscles, which stabilize the ligaments or improve mobility of the ligaments. Spinal biomechanics are going to be addressed, like leg length discrepancy, if that exists. Sacroiliac belt can be very helpful, depending on what the cause of the problem is. You can see an example what it looks like here, but you need to make sure you're wearing it properly. And to be honest, I would go through a healthcare professional to have that properly fitted and you know what you're doing with it, because if you don't, and if you're using it incorrectly or not, you shouldn't be using it, it can cause more problems. And typically, this is used in an acute phase of SI joint issues, or if it becomes chronic, sometimes you can use it occasionally to stabilize it as well, too. Okay, so why BIOFLEX therapy? Well, what we do is something called photobiomodulation therapy. And what it can do is decrease inflammation and obviously pain. It can increase blood flow. Blood flow is critical when you're trying to heal an injured area or help supply nutrients and get rid of waste products out of an area. It can accelerate injured tissue healing. It can modulate collagen production, which is really important, and maturation to help ligaments heal and reduce scar tissue and adhesions. This type of therapy is very safe, no known side effects compared to NSAIDs, say. It's non-invasive, and it targets the injured and or inflamed tissues that affect the SI joint, obviously the muscles, cartilage, ligaments, and fascia. There's a bit of research, I pulled this paper up. This paper was talking, it was just a pilot study of 9 patients, not a lot, I admit it, but it was interesting. 4 males, 5 females, middle age, I suppose. If you live to 100, that's middle age. They were all diagnosed with SI pain. They used 830 nanometer wavelength. That's what we use as well. And it was applied directly over the tender areas twice a week. So over the SI joints for 5 weeks. They did 10 sessions. And of those, 8 of 9 patients showed significant pain improvement, and 6 demonstrated significantly increased trunk mobility. So it not only improved pain, it reduced, or it improved mobility and function. So they concluded that low-level laser therapy, which is now the older term for photobiomodulation therapy, was effective for sacroiliac pain, maybe due to, they postulated improved blood circulation, inhibition of pain, removal of irregularities of the SI joint articular surfaces. So lots of different potential ways where they figured it may be helpful. Okay, so to treat this, you're going to choose a lower back protocol. You're always going to start with stage 1 or level 1. And allow for several treatments before moving to the next stage. Again, if you don't feel your symptoms are improving, then you can go on to the next stage, but you need to give it some time, not just one session, okay? If you feel your symptoms are not improving, then let's get a good diagnosis. If you haven't already, make sure you're addressing all the other issues. Don't advance the stages too quickly. Obviously, avoid aggravating symptoms. You may even want to stop treatment for a little bit and then reinitiate therapy as well. Now, as far as where to place the equipment, the first 2 placements really, now I'm assuming it's bilateral on both sides, but if it's not, you're just going to do one placement initially over the SI joint, similar to what the diagram I'm showing you here. You can place it over that area and you can lean back into a pillow or a cushion to keep it in position. Make sure it's on bare skin. Make sure you don't have any creams or BioFreeze or menthol creams on there. Remove all that before applying photobiomodulation. Once you've done one side, if you're going to do the other side, then let it cool down for a few minutes before doing the other side. I say that because they're designed to be used with air circulating around it. And if you're cushioning it or has between a cushion, the electronics will warm up a little bit. So you need to let it cool down a little bit so it doesn't cause any overheating issues. If it gets too hot, it will automatically shut off anyhow. Okay, another placement I highly recommend is directly over that lower back. That's the L5, S1, sort of the attachment of the lumbar spine to the sacrum. That area oftentimes is affected for sacroiliac joint dysfunction. So I'm going to recommend treating that area as well. Okay, so minimally 2 placements and oftentimes 3 placements is what I would recommend. Now, you can even add treatment over on the buttocks if it's painful, or the hamstrings as well, if those are involved. Then you can use the appropriate protocols to treat those muscle groups as well. So if I'm treating the gluteal muscles, I'll use the hip protocol. If I'm treating the hamstring area as well, I think I would use the hip protocol as well, because it's a large muscle group. So initially treat 4 to 5 consecutive days in a row, just once a day, especially if it's really acute. If it's chronic and been lingering, you don't necessarily need to do that. But initially to start, it's helpful to get things kind of going. And then you can do alternate days, maybe up to 3 times a week. You can kind of push it to 4 times a week, but minimally 3 times a week, 2 to 3 times a week, around that range. I know that research did it twice a week, but we usually recommend 3 times a week. Then as things are really improving, then I would go down to maybe twice a week and then eventually once a week. If you have a chronic problem or there's an issue in there, arthritis or whatever, you can do maintenance treatment, might be once a week or even sometimes twice a week, however much you need. But if you have an ongoing problem there, then you should be treating it ongoing along with doing your exercises as well. So this is a repeat on my apologies, and it's going to go to the next slide. So what is the big picture? Ensure you have an accurate diagnosis and understand what it is you're treating and what's causing the problem. To be honest, you need to see someone that knows what they're doing, right? It's complicated. There's lots of potential areas you need to focus on to get yourself better. Once you figure out what exercises and all the rest of it, that's fine. But adding massage, adding manual therapy, adding other things will be helpful along with photobiomodulation. Okay, so make sure you see a healthcare professional. Be patient. SI joint problems tend to be, unless it's acute trauma, tends to be chronic. They've taken a while to develop due to micro trauma, shearing, that kind of thing that occurs at the joint over a long period of time, or secondary to pregnancy, that kind of thing as well. So you need to be patient. It's not going to go away overnight. Personally, I would avoid surgery, injections, medication. Give this a try first. See a healthcare professional. I think most medical doctors would probably recommend that. They might also say, hey, take some Aleve as well, or whatever the case may be. If you watched one of my webinars recently, there's a link to taking NSAIDs like Aleve that leads to the development of chronic inflammation because the acute inflammation wasn't resolved. So there's that. Personally, I don't think they're really going to do anything to help the resolution of your problem. And that's what you want. So always confer with a healthcare professional. And remember, you could have a serious problem that is causing your pain. So make sure that's ruled out before you start to treat yourself. Do you have some upcoming events, some webinars coming up for those of you that use our professional grade equipment? I'm going to be talking about the red laser probe. The next personal therapy system, I'm going to be talking about menstrual cramps and pain or dysmenorrhea and how to use our equipment for that. And then for any chiropractors listening, or if you know any chiropractors that you want to recommend BIOFLEX to, I have a little webinar on specifically on chiros and why they may want to use laser therapy in their practice. Lastly, if you happen to be in the Southern Ontario area and you want to see us live, because we're entertaining and all, we do have a fundamentals and clinical applications of laser therapy in-person event, November the 12th at Kingbridge Center, a beautiful spot up in King City. Tickets are only $99. It gives you a nice gourmet lunch for a chance to listen to some amazing speakers like Dr. Ben Ewan, a chiropractor out of Halifax, Dr. Randy Santiago, our clinical research director that guides all of our research and clinical trials, Slava Kim, our clinic director, and I may even say a few words myself. So if you're interested, go to our website and join us. You can also see our equipment, try our equipment out, and that kind of thing as well too. If you know anyone that might be interested, we'd love to hear from you and always appreciate the referrals as well. All right, so I'm thinking that you may have a few questions here. Question here. PJ, I'm trying to understand your question. I may have addressed it already, but about preventing sacroiliac joint pain, if you have a pain spike, or how frequently should the series be run. So again, prevention-wise, that's more along the lines of strengthening, supporting core muscles, stretching hamstrings, that kind of thing. And this being used as a modality to keep any inflammation down. So using that on a maintenance basis, what I'd recommend for prevention. For acute, I mentioned earlier, 3, 4, 5 times days in a row, then going to 3, 4 times a week as well. Question from Connie, how frequency and intensity can you use it in a day or a week if lower back sciatic pain is bad? What's the max? Usually once a day. However, if it's really bad, you can use it morning and evening for a few days in a row, but the body needs a chance to actually, actually metabolize and do the things it wants to do. So you don't want to over-treat either. It's not like, doing it 5 times a day is going to be better. In fact, it won't. So probably once a day, or if it's really bad, morning and evening for a few days kind of thing, and then just once a day, and then every few days or every couple of days. What's the theory about taking a couple of weeks off and then restarting again? I think the theory for that is that the body can accommodate to what you're trying to do. And sometimes taking a bit of a break, the cells and the tissues, they kind of like are given a chance to kind of reset, you might say. It's not really the proper way to say it, but if you give it a rest, they may be more sensitive to the light when you reapply it. I do find that sometimes that's very helpful in patients. It doesn't always work, but if you're finding the results plateauing or not as great as they were before, just taking that break and then initiating again, in fact, might be very helpful. See if there's any other questions here. Can the device be used over bone areas if you're trying to get it to inflamed joints? Absolutely. In fact, the sacrum, there's not a lot of tissue between the skin and the bone. There's just subcutaneous tissue, epidermis, so maybe a bit of fat tissue, the ligaments in the bone. So definitely can use it safely over bone. In fact, it's very helpful to do that. Question here is, what is the problem if you start on level 4 for acute injuries? Well, it's not a problem, but I don't recommend that. The reason for that is sometimes in acute scenarios, lower levels is more effective than higher levels. It differs for different people, not all the time, but I do find the lower levels can sometimes be more beneficial, but you can play around with it. It's not like it's going to hurt you, but that's what we usually recommend. Oh, I see a great testimonial here from Anne from Fenelon Falls, which is really beautiful, up in Ontario. Had many years of SI joint pain recently and had BIOFLEX treatment, and it helped immensely. And if you would like to contact me and do a little testimonial, I would love to hear about that. And for that matter, for anyone that feels that this is doing a great job, then I'd love to hear from you as well too. Okay, that is it for today. Hopefully I see some of you at our live event. Oh, I do see one question here. Hang on a second here. Could excessive sitting also be the cause of SI joint pain due to chronic axial loading? I think so. I think because you shift your pelvis as well when you're sitting, and the ligaments will sort of, and muscles tighten to that position. So I think that can also be a cause, Keith, as well. Last question here. When you're treating the two areas to the side of the spine and then place the array horizontally, it looks like you are covering some of the area twice. Is it okay to do the treatments over the same area right after the other treatment? Oh, I got it. So actually, you're right. There's a bit of overlap, but not a lot. Most of the first placements are over the SI joint, so it's shifted to the side, not so much over the spine. But when you do the horizontal one, you'll get a little bit maybe over the SI joint, but you want to shift a little bit higher up over the lumbar spine. So there'll be minimal overlap, and that's not a problem. All right, thanks very much, everyone, and have a great day. Stay safe, and we'll see you next time. And again, if you can join us on November the 12th, we'd love to see you. Last question from Harvey. Can patient use photobiomodulation while taking NSAIDs? Yeah, there's not a contraindication to do that, Harvey. That's okay. And I'm not here to tell you not to use NSAIDs, even though I gave you a comment that I'm not necessarily recommending it. But if you choose to use NSAIDs, it's not going to necessarily be contraindicated to use light therapy at the same time. Thanks again, everyone. Have a great day.